Hi, I'm Mandy Cotton. I'm a family nurse practitioner, and today we're going to talk about how to do a patient consultation. The two patients that I'm going to speak with today have been previously identified with both lab work as well as the completion of the patient symptom checklist. So Susan, when you were here for your well woman exam, I had you fill out some paperwork that identified some symptoms. Can you kind of review what some of those symptoms were that you've been dealing with?
Yeah, I was really having a lot of trouble sleeping at night. Getting to sleep was terrible. I couldn't remember anything. And real dry skin, brittle nails. Those are probably the
biggest
things,
symptoms?
yeah.
Okay, cool. So I went ahead and I drew a hormone panel on you because of the identification of those symptoms that you were having. A lot of those symptoms to me sounded like they could be related to hormone deficiency. So I'm going to go ahead and review those labs with you, kind of give you an idea of what symptoms may be linked to certain hormone deficiencies, and then I'll give you my recommendation. You can ask me whatever questions you have at all, okay? Okay, so based on these labs, your testosterone level was less than 12, so pretty much non-existent. We would kind of expect this based on menopausal status. So testosterone less than 12, I'll make some notes on here for you so that way you can take it home and review after our visit today. So we really want the testosterone to be 80 to 100, but optimally we want it about 150 to 250. That's where most female patients tend to feel their best. So I'll make notes of that for you on here. So low testosterone contributes to a lot of different symptoms. Fatigue, decreased libido, brain fog like you were talking about, irritability, big time insomnia, trouble building muscle, trouble losing weight, sometimes anxiety, depression. Sometimes low testosterone even causes heart palpitations. Okay, so there's a whole lot of symptoms that can be impacted by that testosterone level being low. Your vitamin D looks great. It's at a 59. We really want that greater than 40. So vitamin D is very important for energy as well. Plus it's very important for your bones, your heart, and cancer prevention. So yours looks great. Whatever you're doing, continue to do that. Your vitamin B12 was at a 641. That's also very important for energy. We want the B12 to be greater than 600, so you're right there on the border. A good B12 supplement may help support your energy level as well. Okay, so when we look at estrogen levels, we look at your follicle stimulating hormone. That's kind of the reciprocal number to your estrogen. So when follicle stimulating hormone is high, estrogen is low. Your follicle stimulating hormone is a 69. Anything greater than 23 is considered menopausal. So I'm going to safely say that you're in menopause, along with the fact that you haven't had a cycle in several years. So low estrogen, which the level is not all that important other than the fact that this follicle stimulating hormone is elevated, low estrogen contributes to a lot of different symptoms as well. So vaginal dryness, decreased skin elasticity or dry skin, so you'll see more wrinkles and that kind of stuff. Skin doesn't feel as elastic as it used to. Weight gain, irritability, those are the main symptoms associated with estrogen deficiency. The other thing I see on your labs is your thyroid is low. Have you ever been told that before?
No.
No?
I've asked about it because at work I feel really tired.
Yeah. And a lot of the brittle nails and the dry skin, those symptoms that you're discussing, those kind of go off in my mind as major thyroid symptoms. So when I look at your labs, we do a full thyroid panel. We do TSH, total T4, and a free T3. Your free T3 is your active thyroid hormone. Free T3 is the best indicator of thyroid status, and a lot of providers don't check that full panel. So your T3 is a 2.6. It should be 3.5 to 4.3. So low T3 contributes to a lot of different symptoms. Belly fat, weight gain, cold fingers and toes, dry skin, thinning of hair, constipation, depression, and fatigue. Okay, so a lot of the stuff that you were kind of talking about. Your TSH, which is what the majority of doctors check, is a 2.4. So that's within the normal lab range. However, optimal and ideally, the TSH should be less than 2. So it's creeping up, okay? Your other labs look pretty good. Liver and kidney function look great. Your electrolytes look great, and your blood counts look great, okay? So what I would recommend, based on your symptoms as well as what these labs show, is a thyroid replacement. We use a natural thyroid medication. It's called desiccated thyroid. The reason we use that is because it has 2 different kinds of thyroid hormone in it. So it'll get both of those thyroid hormones up where they need to be, which will really help with your symptom management. Both the estrogen and testosterone can go in the pellet form. That gets inserted into the fat tissue on the hip. It gets absorbed over a period of about 4 months, and then you'll come back for reinsertion. And then, because you have a uterus, we're going to put you on some progesterone. Progesterone will be a pill that you take in the evening time that you want to be very, very consistent with, because estrogen and progesterone need to be in balance in the female body. So the estrogen is in the pellet, so releasing consistently throughout the day. So we want to make sure that you take the progesterone every evening, because the half-life of progesterone is only 12 hours. So we want to be very, very consistent with that, so that you don't end up with any postmenopausal vaginal bleeding. So because you haven't had a cycle in however many years, we don't want to reinitiate that bleeding cycle.
No,
right? It's like the only benefit of menopause, right? Is to not have a period. Yeah, I agree. What questions do you have?
I've heard that hormone replacement can cause breast cancer. Is that?
There's a lot of patients that have heard that, and it's kind of a misinformation.
Oh.
So bioidentical hormones do not contribute to breast cancer. Estrogen does not contribute to breast cancer risk either. However, there have been studies that have shown that synthetic progestins do increase your risk for breast cancer. So that's not something that would be in the pellet, and it would not be something that we would prescribe to you either. So you are at no increased risk of breast cancer with using bioidentical hormones.
Very good.
Okay.
If I start the thyroid and progesterone, can I just take them both together at the same time?
It's better to not do that. So thyroid is best taken in the morning on an empty stomach. And then we do recommend that you wait about 30 minutes after taking it in order to, before you eat any food or have any coffee or anything like that, so that the body really absorbs it well.
Okay.
Progesterone is better taken in the evening time. And the reason we take thyroid in the morning is because it's meant to give you some energy.
Okay.
The reason that we take progesterone in the evening time is because it kind of has a calming effect on the body. So a lot of times patients will report that it helps them sleep better at night.
Makes sense. Okay.
Okay.
Well, I can do that.
Okay.
What kind of side effects might I experience from getting pellets?
So side effects are pretty minimal. Occasionally, about 2 to 10% of the time, females will experience increased hair growth, which women, unfortunately, as we get older, we have more hair growth in random places than we used to anyways. But midline hair growth can be related to testosterone increase. So lip, chin, tummy, that's typically where you're going to see it if you're going to see it. Also, 2 to 10% of people will experience an increase in acne. Most of the time, those are people that had a history of acne in adolescence. So we can do dose adjustments. We can also use prescriptions to kind of help alleviate some of those side effects. So it's not something to be super worried about.
Okay.
Occasionally, I'd say less than 1% of the time, we will have some patients that have frontal hair loss. Again, as we get older, we lose hair. Most hair loss is related to thyroid deficiency. So once we can get the thyroid in a good status to where you have enough thyroid hormone in the body, you should see less and less hair loss over time. Okay. But if you think that that's increasing for any reason, or that you're noticing more hair loss, you need to let me know. Because some people will convert testosterone into a different metabolite called DHT, or dihydrotestosterone. This metabolite messes with the hair follicle cycle. There are medications as well as dose adjustments that we can do to alleviate that side effect as well.
Okay, very good.
Okay.
Everything that you said makes a lot of sense. Can I go ahead and
Of course.
today?
Of course.
What's involved in that?
Okay.
Can I drive home?
Of course. So what we want to do is I will actually have you lay down on the table. I'm going to numb up a very small area on your hip, and I'll make a small incision. I'm going to put the pellets in, seal that up with a steri strip, and then put a bandage on top of that. Your bandage will come off tomorrow. The steri strip is going to stay in place for 3 days. Your activity restrictions are for 3 days. No hot tubs, no bathtubs, and no gluteal exercises. We will do labs again 6 weeks after we do your pellets today to make sure that we get your levels optimal. The labs at 6 weeks are very, very important because then that gives me an idea if I need to do dose adjustments for the future. With the thyroid, we'll check the thyroid labs at 6 weeks, and it's very, very important that you take your thyroid pill the morning you have your labs drawn and then wait 4 hours after taking it to have those labs drawn. That gives me the most accurate read. We will adjust thyroid dose if needed at that point in time, and then every 4 weeks we will recheck your thyroid until we get you therapeutic. Okay. So if thyroid looks great in 6 weeks from now, we'll just continue that dosage.
Great. Will you write all that down for me?
Of course. I have all of your instructions right here, everything about the post-pellet instructions, kind of what to do, what not to do, what to expect, as well as recommended supplements are written right here for you, as well as their dosages. Your thyroid and progesterone dosage and how to take them is also written on this sheet, and I will go ahead and send the thyroid and progesterone prescriptions today to your pharmacy.
Fantastic.
Okay.
It sounds so simple.
And that concludes the consultation with the female patient. Hi, I'm Mandy Cotton, family nurse practitioner, and today I'm going to discuss how to do a consultation with a male patient. Hi, how are you doing today?
Very well, thank you.
Good. How'd you hear about us?
A friend of mine had been taking pellets for some time. He keeps talking about it, seeing as how I've lost a lot of energy, and especially at the end of the day, I decided to come in and chat about it.
Well, wonderful. I'm so glad you're here. We did get your lab results in that you had drawn prior to today's consultation. So if it's okay with you, I'm going to go through those labs with you,
Sure.
kind of give you my recommendation, and then you can ask me whatever questions you have at all.
Okay.
Okay, so your testosterone level was a 333. We really want it to be 800 to 1100, so it's pretty low.
Very low.
The reason that we want testosterone to be 800 to 1100 is because of this chart right here. This is based on some studies that showed that most men around where you're at, 300, are going to be pretty symptomatic. I find that most of my male patients, when they refer to low testosterone symptoms, are something like you're saying, low fatigue, especially in the afternoons, maybe feeling like they need to take more naps when they get home from work, or falling asleep while dinner's being made, having less motivation, less stamina, sometimes erectile dysfunction, sometimes not, and sometimes just decreased quality of erection. So maybe not able to maintain an erection, or maybe climax is a little bit different than it used to be prior to. A lot of patients will say, why 800 to 1100? And a lot of it is based on this. So men that have testosterone less than 600 have an increase in all-cause mortality. Men that have testosterone levels lower than about 800 or 840 have an increased risk for prostate cancer, increased risk for diabetes. And then higher than that, 900 and plus, is really where we get brain protection. So the bigger picture is, I know you didn't come here and say, how can you protect me? But the bigger picture is that hormones can be protective in the body. So while we're trying to alleviate symptoms that you're having, fatigue, decreased stamina, decreased motivation, sometimes brain fog, joint pain, not sleeping quite as well at night, the bigger picture is that hormones can be protective to your bones, your brain, your heart, those kind of things. Does that make sense?
Okay.
Okay. So we do get a PSA, which is an indicator of prostate health. Yours was at a 0.6, which is great. We want that less than a 2.5. Okay?
Okay.
We also got a vitamin D level on you. Yours was at a 32. We really want that to be greater than 40. Vitamin D is very important for your bones and your heart and cancer prevention, so we definitely want to get that level up a little bit. Plus, it's going to impact your energy in a beneficial way.
Okay.
Okay? Your thyroid is kind of borderline low. Your free T3 is at a 3.0. We really want it to be 3.5 to 4.3. So low thyroid contributes to fatigue as well as belly fat, weight gain, cold fingers and toes, dry skin, thinning of hair, sometimes constipation as well. Are you having any of those symptoms? Thinning of hair. So with it being at a 3.0, we could start you on an iodine supplement, or with the thinning of hair, we may recommend a low dose on the thyroid medication. We use a natural thyroid medication called desiccated thyroid. The reason that we use that over some of the synthetic preparations is that it has both thyroid hormones in it, so both T3 and T4 in one pill. So we'll go ahead and start you on that. And then the testosterone will be in the pellet form. That will get injected into the fat tissue on the hip. It gets absorbed over a period of about 4 to 6 months, and then you come back for reinsertion. We always check labs 4 weeks after we get your pellets and start you on the new medication to make sure that we get your levels into the optimal range, so that 800, 900 to 1100 range. And we do that to make sure that you're getting therapeutic and feeling the best that you can feel. Most of my male patients come back for reinsertion between 4 and 6 months. So I'd like to go ahead today, if you want to get your pellets, we can do that. Let me talk to you a little bit about the procedure.
Are there any side effects?
So typically in males, the main side effect that I see is about 10 to 15% testicular shrinkage. That is one of the only side effects that I see in male patients. Occasionally, you'll see some male patients will convert testosterone into estrogen. All men have estrogen, and you need some estrogen at healthy levels. But if that level converts at a higher rate, which it does in some people, you can get some unwanted side effects. Nipple sensitivity, sometimes some breast enlargement, as well as feeling overly emotional. So that is one of the things that we check on those follow-up labs. One of the other side effects you can see is an increase in your hemoglobin and hematocrit, which is something that we also will check on those 4-week labs to kind of see where your levels are at. In order to kind of front run that and kind of prevent the estrogen levels from rising, we put you on a supplement called DIM. So DIM does a couple different things in the body. It helps you maintain a healthy balance between testosterone and free testosterone. You want to have more freely circulating testosterone in the system because that's where people get kind of the feel-good effects of the testosterone. So more energy and more libido.
I take a number of heart medication pills every day. What kind of interaction might there be between them and the pellets?
So there's not going to be any interaction. We are going to monitor your blood levels to make sure that your hemoglobin and hematocrit remain in a normal range, but otherwise you shouldn't have any impact. And testosterone is actually beneficial to the heart and going to help decrease inflammation in the heart. So you're actually going to see some benefits from this as well.
What about my antidepressant that I take?
So I have a lot of patients that come in that are taking antidepressants. I always encourage them to continue through this first round of pellets because I want to get you optimal before I start removing other things kind of from your regimen. So what I would recommend is continuing the antidepressant through this first round, and then when we follow up in 4 to 5 months from now, we can kind of talk about how you're feeling. And if you're feeling a lot better mood-wise, we can definitely talk about how to wean off of that medication.
Okay. My son is just 34 and recently got married, and he's having a number of the same symptoms that I am. What would you recommend for him?
Well, he would definitely be a candidate to have his labs drawn. I think looking at his testosterone and thyroid levels would be a really good idea. However, we do recommend not getting on pellet therapy if he's actually trying to conceive right now. So if he and his new wife are wanting to have a baby, we recommend kind of holding off on the replacement therapy for now until after that. That is because testosterone from an external source, like pellets, will decrease his sperm count, and it takes about 8 months for that to return. So especially with him having a new bride, that would be a conversation I would definitely get him to have with her prior to coming in for a consultation. So do you have any questions, or would you like to do your pellets today while you're here?
Well, it all sounds very good. Very good. What's involved with the procedure? And
Sure.
Can I go ahead?
Of course. We can definitely do your pellets while you're here today. Let me talk to you a little bit about what the procedure entails. Okay. So what I do is I numb up a small area on the hip with some local anesthesia. I make a small incision, and then I put the pellets into the fat tissue on the hip. I seal that up with a steri strip, and then I put a bandage on top of that. The bandage stays in place for 7 days, so we ask that you kind of refrain from some activities. So no hot tubs, bathtubs, swimming pools, or gluteal exercises for 7 days. And that's just to allow the area to heal, so that way you don't have any issues with infection or the pellets coming back out of the incision. After the procedure, we always do labs 4 weeks later, and that's again to make sure that your levels get into the optimal range. So what I'll do is I'll go ahead and send your thyroid prescription over to your pharmacy, and then we're going to put you on a vitamin D supplement as well as the DIM. Iodine is another supplement that would be really great to help support your thyroid health. All of these supplements you can get here in the office today if you'd like.
Very good. Well, let's go ahead.
Okay. This concludes the patient consultation with a male patient.